a soul whose intentions are good. Oh Lord, please don't let me be misunderstood.
Hi, my name is Jody Corey Bloom, and I am a professor of neurosciences, and I'm the director of the UCSD MS clinic. So we follow about 500 people with MS there. MS is a neurologic disease. It actually affects people usually, unfortunately, in the prime of their life. It's most commonly makes an appearance maybe in the 20s and 30s. And what happens is that the myelin, which is a fatty sheath that covers the nerve cell axons or cables, that myelin is attacked by cells of the immune system. And as a result of that attack, the myelin sheath breaks down. It's kind of like losing insulation on a wire cable. And so because of the loss of that insulation, the nerve cells don't conduct the impulses or the messages as well as they should. People who have MS attacks can experience things like loss of vision or problems with weakness or numbness. Sometimes they have difficulty with balance, difficulty walking. Some of our patients complain of problems with controlling their bladder function, for example. And a lot of people end up with problems with cognition, problems with short-term memory, with attention, concentration, and fatigue. Fatigue is also a very common symptom.
Other symptoms include dizziness and vertigo, sexual dysfunction, pain, emotional changes, depression, spasticity, speech disorders, swallowing problems, headache, hearing loss, seizures, tremors, respiration or breathing problems, and itching.
I'm Maria Arroyo, and I was diagnosed with multiple sclerosis 12 and a half years ago. I'm numb from basically the chest level down, and my feet are completely numb. I also have what's called spasticity in my legs, especially at night, and your muscles get very tense and react like twitch. And so I have to take medication at night to relax the muscles so that that spasticity doesn't keep me awake at night. So I've got a lot of different symptoms from MS. Usually the walking is an issue. I can't walk very far at all. I use a motorized wheelchair to get around. Before I ever knew what multiple sclerosis was, I joined the Army right out of college. Actually, it was called the Women's Army Corps back then. It was during the Vietnam era. When I arrived at Fort McClellan, Alabama, we were on a bus, and we saw the people marching around in fatigues and combat boots. But I couldn't figure it out. It was a women's base. I'd found out soon enough. And I continued to be active once I got out. I was still running. I ran about 3 miles a day on weekdays. On weekends, I would run further. One morning, I woke up and my right leg was numb. My leg was numb from my hip all the way down to my foot. It felt very heavy, like a piece of wood. And my face became numb and my tongue. And I kept trying to feel my face and my nose. I figured it was a sports injury. So I thought I'd try to run and work it out, but I couldn't run. But I did begin seeing doctors, and they began to do MRIs. They started at the hip level, and then they did an MRI of the lower back, the mid back, the upper back, and finally they did an MRI of the brain. That showed some problems, and so then I had a spinal tap to confirm a diagnosis of multiple sclerosis.
So there are a number of treatments for MS. There's Avonex, Betaseron, Copaxone, and now Rebif. And these are medications that patients will actually inject themselves. The medications are pretty effective. They tend to decrease the number of attacks and the number of new exacerbations by about 30 to 40%. We do have some slightly more effective therapies if people don't do well enough with those, things like Tisabri and a new oral medication called Gilenya. But those medications have more side effects. So the cause of MS is a very good question. We don't really know exactly, but we think that people are probably exposed to a virus early in their life, usually before the age of 15. And that virus seems to share some antigens or proteins in common with that myelin sheath that we talked about. Do I expect a cure? I'm not sure. I think that a cure usually implies that we get after everything. I don't know if we're going to have a cure, but I do think that we're going to have some medications that are pretty close. People really, I think, probably are going to feel as if they're cured. So I think the future looks really bright. I think people are very excited about some of these new medications that are on the horizon. And even though they may not be a cure, I think they're going to be pretty close. And so I think people are going to be pretty happy with them.
People typically get diagnosed between the ages of 20 and 50, and typically women, Caucasian women, usually 2 to 3 times more often than men. People further from the equator of Northern European ancestry tend to be the people that we see getting diagnosed, and we don't know why. The Pacific South Coast chapter serves 6,500 members who have basically self-identified, stating that they have a diagnosis of MS. We also know, though, that people are affected by MS in the family. We probably estimate that there's at least 45,500 people affected by MS in our community right here. That's just in San Diego, Orange, and Imperial counties. We fund programs and services for people with MS living in our community. And then, of course, we also give half of our resources to MS research. People with MS have a variety of needs. They don't take the same treatments. And because of that, we have a big job, which is to try and serve each individual person with MS at least once a year in a really direct way. For some people, that might be getting a newsletter. One of our biggest programs that we offer is financial assistance. So we know the cost of MS is huge, and most people didn't prepare for it. By the time that their diagnosis comes, they are struck with a financial need and demand on their resources that is enormous. So somebody with MS has an exacerbation and has to leave work, and they're all out of their time off. They don't have any pay. What are they going to do? How do they pay their rent? Most of us aren't prepared for that. So we help with rent, we pay for mobility equipment, we pay for utility assistance, cooling devices, chore services, respite care. Pretty much anything will be considered. We like to say, if you have a need, call us and we'll work with you to try and determine where our services best fit your needs. The National MS Society is very committed to MS research, and we're actually just embarking on a new initiative called the NOW program, No Opportunity Wasted, and we're committing $250 million in MS research by 2015. We're really, really excited. It's the most aggressive research campaign we've ever embarked on. Most people would be shocked to know that we don't receive government funding. All of our fundraising is private donation, people coming from the community who care about MS, literally writing us a check, walking, biking, golfing. We have fundraisers that happen all throughout the year. They're really awareness campaigns as well, because not only do people raise funds at these types of events, but they also promote community awareness and let people in the community know that the MS Society is here and that people with MS are here in our community. Our biggest public awareness fundraising event probably of the year is our bike tour, and it raises over $2 million. We have thousands of cyclists who come out. And then we also have our Walk MS event, and people create teams and fundraise, and we raise almost $2 million at that event.
So, why do you walk? Well, I walk for a cure. But I don't walk, I roll. That's how I roll.
I'm just a soul